Those who are doing as prolific as you are doing, probably the anterior as well as posterior. So he will be talking on the different challenging situations in cataract surgery.
Thank you, Dr. Nitin. And my job has been made very easy by Dr. Rudra Ghosh. So could you please start the video? So basically, it's just a potpourri of various cases in which I've used this BHEX ring. So this is a patient with small pupil, and you can see, because you can see the retroillumination, the pupil wasn't dilating. So one eye, I had done both the eyes. So one eye I had done without the aid of the pupil expander, but the pupil was very much distorted. And in these cases, they have a lot of glare and halos as it is. So in the next eye, I chose to use a pupil expander. So it's just not the expansion of the pupil that is important, but the stability of the iris. The pupil expansion device not only stabilizes the iris, as well as it dilates. So your iris doesn't move, and the incidence of CME is less. So coming to the case that Dr. Rudra was talking about, this is a post-uveitic cataract. So this is the stretch pupilloplasty that is being done. Don't have to do it too much. The moment you do it too much, you will have a larger pupil at the end of it. So do it enough just to be able to implant this BHEX ring. So implantation, as one doctor was asking whether you need a special device. Yes, you do need this type of forceps, which makes it very easy. And even if you don't need a very large pupil, as I said, you need just enough to be able to do a 5.5 to a 6 millimeter rhexis using the micro rhexis forceps. You can also use a hook to, where you want the rhexis to be. You can just push the implant. And again, usually the uveitic cataracts are soft cataracts. And the only thing that you need to do is be able to dilate the pupil and implant the intraocular lens, and don't have a very large pupil at the end. But even if you have a very large pupil at the end, you can do a pupilloplasty. This is another cataract, this is a pseudoexfoliation eye with a very hard cataract, and the initial rhexis was small to begin with. So you can see this is a very hard cataract, direct chop being done. Sorry for the fast forward, because otherwise I won't be able to show all the types. So this case had a zonular dehiscence. I have put these capsular hooks, and because of the, even in the presence of the pupil expansion device, you can still put in these capsular hooks. These are different from the iris hooks. Putting in visco again and again in hard cataracts. Then putting in the CTR. This was a CTR injector, and then putting the intraocular lens and removing the implant. This is another modification of the BHEX ring. This is the BHEX, this is Octa. This gives you a larger diameter of the pupil expansion. And if you have a very hard cataract and you want a larger pupil to begin with, and most often than not, these patients who come with these very hard cataracts are old, very old patients, and the incidence of a floppy iris is there because they are on some sort of medication for the prostate. So once you have such a large pupil expansion, it makes it very easy for the visualization. So you could compare the visualization that I had before and that I have now. Of course, this has a learning curve. This is another eye. The VR surgery was done in Nepal, and the patient hadn't regained any vision. This is the Madhur ring that even Dr. Rudra talked about. So this again gives a little bit larger pupil to begin with than the BHEX. So what you saw was that I had done the staining of the Rexes after putting the visco. So that is another trick that you need to learn. That you don't need to stain the anti-itch capsule. So this patient had, you can see that there is a membrane sticking to the posterior capsule, and you will see that I have been able to remove this membrane in one piece. So here, just by the hydro, the membrane comes out, and then you have a pristine posterior capsule. And also, the patient had silicone oil, that is why you can see the cannula there. This is another patient in which I thought that I will be able to do away without a pupil expansion device. But then you can see that the pupil is getting distorted, it is coming into the side port. So this is an intra-op use of a pupil expansion device. So I chose to use this rather than the BHEX because I was slightly scared of the sharp edge of the BHEX. So putting the first scroll in its place, and then the rest are not as difficult. So you have to be slightly careful. You don't have to engage the Rexes. This was the last video. So you can see that once you put the pupil expansion device in place, stabilizes the iris, and you can do whatever you want to do with the cataract, and put in the intraocular lens very easily. So rather than struggling and getting the phaco, getting the iris to get stuck in the phaco and getting a distorted pupil, it's always better to use these expansion devices. And as Dr. Rudra also said, you must not be fearful of using these devices. It must